Are you tired of burning up 1 minute and having chills the next? Having achy muscles, feeling weak, tired, or simply fatigued, and now have a headache you just can't kick? Don't let little infections or illnesses keep you down, but let antipyretics turn those symptom frowns upside down. Acetaminophen, NSAIDs, and salicylates all have antipyretic properties. However, not every drug within each class is recommended equally. Ibuprofen is the NSAID drug of choice for children greater than 6 months of age and adults. Aspirin is a salicylate drug of choice for fever in adults. And acetaminophen is safe for all ages starting at 6 months and for those who cannot tolerate ibuprofen. So what is fever? It's an elevation in an individual's normal low and high daily temperature levels. Normal body temperature is 37 degrees Celsius or 98.6 degrees Fahrenheit with variations, and fever is any temperature equal to or greater than 38 degrees Celsius or 100.4 degrees Fahrenheit. Although fevers are worrisome for most, fevers help our bodies to fight infections, usually viral or bacterial, by stimulating our immune system and making it more difficult for those viral and bacterial pathogens to survive in the hot environment our bodies have created by raising the thermoregulatory set point of the hypothalamus located in our brains. However, fever can also cause discomfort associated with the increase of metabolic demands and come bearing gifts of inflammation and pain. Antipyretics are short-term fever reducers, but these drugs can combat fever's gifts such as myalgias, arthralgias, headache, reduced chills, and insensible heat loss, and discomforts to improve hydration and relaxation. But before moving forward, it is important to remember that fevers are not an illness, but a symptom that indicates an underlying disease process. And the decision to treat fever is based on the assumption that there is no diagnostic benefit to allow the fever to persist, as they will usually resolve on their own in a few days. The red flags for treating fevers in children or adolescents with chickenpox or influenza due to the risk of Reye syndrome, a rare but serious condition. Fevers in children less than 3 months of age, fever greater than 40 degrees Celsius or 104 degrees Fahrenheit, or fever with seizures, loss of consciousness, confusion, stiff neck, or trouble breathing should seek immediate medical attention. Antipyretics reduce prostaglandin synthesis that results in lowering the body's hypothalamic set point, which results in increased dissipation of body heat via vasodilation and sweating. Ibuprofen and aspirin inhibit synthesis of prostaglandins by inhibiting cyclooxygenase, an enzyme necessary for prostaglandin synthesis. Inhibiting cyclooxygenase is also what gives these medications strong antipyretic and anti-inflammatory effects, kicking those body aches and pains to the curb. Acetaminophen is a poor anti-inflammatory agent, but is believed to act centrally on the hypothalamic set point, making it an excellent antipyretic without the adverse effects associated with NSAIDs and aspirin. These medications are rapidly absorbed after oral administration and widely distributed to the body fluids and tissues, and metabolized by the liver and heavily excreted by the kidneys. However, they are variable individually. For example, the excretion of aspirin is dependent on urine pH and can be decreased at acidic levels. So, making sure to drink plenty of fluids with administration can help avoid toxicity. Medications that inhibit prostaglandin synthesis can cause premature closure of the ductus arteriosus and other unwarranted effects to the fetus and mother. The decision to treat fever during pregnancy must be carefully weighed in terms of risk and benefits. Aspirin is pregnancy category D and is contraindicated in pregnancy and breastfeeding women. Ibuprofen is pregnancy category C and contraindicated after 30 weeks and not recommended during breastfeeding. Acetaminophen is pregnancy category B and is the only antipyretic recommended for use in pregnancy and breastfeeding women. There are many adverse reactions associated with antipyretics, such as ibuprofen and aspirin when taken orally, but most commonly cause GI irritations. Administering these medications with food will slow absorption, but it will not reduce the amount that is absorbed. To reduce GI upset, you can administer with food and plenty of water and sit upright for 15 to 30 minutes after eating. NSAIDs have a black box warning for increased risk of heart attacks and stroke, as well as increased bleeding, GI ulceration, and perforation, and are contraindicated in patients with active bleeding or recent coronary bypass surgery. Antipyretics may indirectly decrease renal blood flow and increase fluid and volume retention by inhibiting prostaglandin synthesis needed for kidney perfusion. Do not take NSAIDs and aspirins together or alternate antipyretics due to increased risk for serious GI complications and bleeding, and potential dosing errors, especially in children. Consider acetaminophen, if tolerated, to treat fever if you are on warfarin, especially apixaban, or other antithrombotic drugs, as co-administration may prolong prothrombin time because both drugs affect platelet aggregation. Antipyretics can cause severe skin or allergic reactions. Discontinue if skin reddening, hives, facial swelling, wheezing, shock, blisters, or rash occur. These may be signs of severe dermatologic conditions such as Stevens-Johnson syndrome or toxic epidermal necrosis and hypersensitivity. Increased risk factors for hypersensitivity are asthma, sensitivity to tartrazine eye drops, and nasal polyps. Aspirin and NSAIDs have a cross-sensitivity and are contraindicated if hypersensitivity occurs. Acetaminophen can cause severe liver damage. For this reason, patients with liver failure and chronic alcohol use should not use these medications. Some drugs that increase risk for toxicity are carbamazepine, phenobarbital, phenytoin, and rifampin when taken together. This occurs because liver enzymes induced by these drugs cause stores of hepatic conjugates to become depleted, and the liver can no longer properly metabolize acetaminophen into a non-toxic form. Discontinue these medications and seek medical attention if fever continues or worsens after 3 days of self-treatment, or you have vomiting that looks like coffee grounds, black and tarry stools, yellowing of the skin and eyes, ringing in the ears, and behavioral changes, as these are signs of serious adverse effects and toxicity. Monitoring for patients taking antipyretics include liver and renal function assessment prior to use, as well as the measurement of efficacy of the drug demonstrated by reduction of fever and associated discomforts such as myalgias and arthralgias. Additional monitoring for patients who need these medications long-term should be evaluated separately. Always take medications exactly as prescribed. Never double dose. Do not consume alcohol with these products. And never take more than 3 grams of acetaminophen or ibuprofen in 24 hours or 4 grams of aspirin in 24 hours. Rectal suppository dosages for aspirin and acetaminophen should not exceed 4 grams. Dress lightly, even if you have chills. Extra clothing maintains and increases the central body temperature that we are trying to reduce with antipyretics. If you take anything from this video, remember, before you treat fever, make sure the cause is not a serious diseaser, especially in children and infants. Too much acetaminophen can make you quiver, so avoid alcohol and overdose and make liver function less grimmer. It is not worth the bleed. Before you let NSAIDs and aspirins take the lead, make sure you are not in danger. Maybe instead, acetaminophen is what you need. Raynaud syndrome ain't no game, and treating young ones with chickenpox or flu-like symptoms with aspirin makes it hard to tame. Antipyretics are not the best diuretics. Fluids keep things cool, help you pee, and help those kidneys stay fancy-free. Drink at least 8 to 10 glasses of water each day, unless otherwise directed by your healthcare provider. Eat light foods that are easy to digest and put GI side effects to the test. You want to get plenty of rest, but first, rectal and oral temperature is best. I hope you have learned a little bit more about antipyretics and can make fever symptoms look a little more pathetic.